Good morning. Welcome again to another episode of the Dr. Powell Show. I'm your host, Dr. Keisha Powell. Today we have a great topic that I think a lot of people will be interested in: insurance fraud and elderly care. Today's guest is Mr. Sean Hadden from Hadden Insurance Agency. Stay tuned. We'll be right back. Hi, I'm Dr. Keisha Powell, CEO of Powell Therapy Solutions, LLC, and the host of the Dr. Powell Show. I'm a performance psychologist, a certified and licensed autism therapist, and a board-certified sexologist with the American Board of Sexology. Here at Powell Therapy Solutions, we're changing the dynamic of how persons diagnosed with autism spectrum disorders receive services and how treatment is delivered for trauma care. For more information, visit our website at powelltherapysolutions.com or email us at powelltherapysolutions@gmail.com. Remember, Powell Therapy Solutions, real support, real growth, and real inclusion. Welcome back to another episode of Dr. Powell Show. I want to welcome a very important guest today, Mr. Sean Hadden from Hadden Insurance Solutions. Welcome to the Dr. Powell Show. It's such an honor to have you here.
Yeah, it's great to be here. It really is. Thank you.
And today's topic is about fraud, insurance fraud, scammers when it comes to the elderly. But before we get into that, could you tell the viewers a little bit more about yourself and what you do?
Yes, my name's Sean Hadden. I'm actually an insurance agent. I own the Hadden Insurance Solutions insurance agency here in Vernon. We really specialize in helping people with their health insurance, wealth planning, including Medicare and all of the parts that go with it. But I wear a lot of hats in the community, so you'll see me at different events representing different groups that I'm part of. I also work directly with the elderly as the board chair for the Vernon Housing Authority. So I deal with them on a regular basis in their living conditions and how to improve their overall well-being and bringing programs and projects to town to help them for sure.
Thank you so much. That's a lot of hats that you wear. And thank you for what you're doing for the elderly. Having had the opportunity to, take care of my two elderly parents who have recently passed away, it wasn't easy for me to kind of meander around the different types of insurance. They had, I always get them mixed up, Medicaid and Medicare.
Correct. So Medicare is the federal program, which is, your parts, Part A, Part B, Part D, which is private insurance for the drugs, and Part C, which is a Medicare Advantage plan or something similar, where the private insurance company actually administers the Medicare part. And then, of course, you have Medicaid, which is federally and state funded. So that works out where it's a combination, but it's overseen by the state of Connecticut. So it's a different format altogether.
I see.
Different requirements, for sure.
Thank you for explaining that to us, because I know many caregivers are not quite sure how to navigate that. But now we're going to get into the whole fraudulent and scamming piece of it, which I know that, and then again, thank you for being on the show, because we really need that information out there for viewers. What are the most common types of insurance fraud that target seniors today?
Well, if you were listening to WDRC Talk of Connecticut, you probably heard me talk about this before. I had the radio show with Gary Byron on Saturday mornings, we really dug into that a little bit. And we found that for the scammers, what they really like to do is to go after the vulnerability, what parts of your life are going to be really easy pickings is what they really look for. Low-hanging fruit. So they do social media searches and they find out about your children, your grandchildren. You know, what's going on? Another big one that was great was, well, not great, but it was an eye-opener, is you can have a bill show up at your house that you owe all this money, and you're looking at it, you're going, wait a second, what's this from? You know, Medicare didn't cover it? And it looks like it's from one of your providers, but it's not. It was actually spoofed, and they have spoofed mail, comes to the house, and you think it's a bill, so you write the check and you send it out. And it's not even close. So we always ask that you look at what's called the evidence of coverage, or EOC, and you look at your summary of benefits. And then when you receive a explanation letter from the insurance company, they explain what was covered, what wasn't, and it has to match the bill. If not, you got to go back to you know, your insurance and see what's really going on. A lot of times you'll get stuff that you don't have to pay, and you really shouldn't be paying. So you really want to take a step back and look at it, make sure it matches. If it doesn't match, it's not right. Contact your insurance agent regarding that side of the insurance for sure.
Wow, I never knew about that part, because sometimes you do see bills and you really think that they're legitimate and you just rush to pay them. What warning signs should older adults watch for when speaking with insurance agents or receiving unexpected calls?
That's a big one. If you get an unexpected call where you didn't fill anything out online, you didn't fill anything out in the mail, and somebody just calls you up and they have more information about you than anybody else, you gotta hit the brakes there for a second. You might have been a victim of fraud where somebody has already taken that information. If you get a packet in the mail that says, welcome to this new insurance carrier, but you didn't really talk to anybody about that, that's a problem. That means that somebody has switched you without your knowledge. And that can happen as long as they have your zip code, your date of birth, and your Medicare number. It's gone. You can get switched easily. And they do these phishing scams, and my phone rings all the time with these different scams, one of which was, oh, Mr. Hadden, your Medicare number expired. And I want to get your old number so I can make sure I send you the new card right away. Your Medicare number doesn't expire. That's a phishing scam where they're trying to gather information from you. So you have to stop, end that call, hang up right away. Absolutely. Because again, there's so many different scams that are out there. And again, with social media, with the information being so readily available, you can really have a trouble. There's a few common scams that are out right now. One of which is what we call the heart tug scam, or tugging on your heartstrings, the heartstring scam. The other one is it's kind of related. It's more of a family tug. You know, oh, your grandkid's in jail, you need to pay the bail.
I've heard that one.
Yeah, I've heard that one. Well, I volunteer at the airport every Thursday evening. And, you know, I watch people coming into the airport and leaving. I spend more of my time downstairs with the information booth on the lower level. And one of the most disappointing scams that they have out there right now is, it's called the long game heartstring scam. And long game means it's been going on for a long time. And they're very meticulous about how they gather the information, who they target, and they get a lot. And what they do is they over time, this person has been funding, the lifestyle of somebody else, and they'll come up with a great name, great backstory, great opportunity to really connect with that person. Then the time comes where they're going to come see you. So you spent all this money on their ticket, and they sent you a screenshot of what you think is an itinerary, and you see all kinds of information on there. Well, that's just a screenshot from how they would get there with information. That's not a boarding pass. It's not a true itinerary from a company. It's just they went onto Google, they entered in from here to there, got a bunch of different ones, and it shows the pricing and everything, but it doesn't have passenger information on it, doesn't have all that data, and it doesn't show the confirmation receipt. So you paid all this money thinking that this person was getting a ticket. They're not coming to see you. And I see that all the time where people are sitting there at the airport, elderly people, waiting for somebody, for the love of their life to come. And they're
So
never
a lot of people elderly people are being targeted.
Absolutely. They target people that are elderly, people that have retirement plans, people that are, secure. And sometimes they take a lot of money from them.
Well, that's good to know, because it leads me into my next question about why are seniors in particularly more vulnerable than others, and how do scammers exploit their vulnerability?
Oh, absolutely. The seniors are going to be more vulnerable because they've lived longer. So as you live, you make more contacts. More contacts means that you have a larger network. You also have maybe planned for retirement. So you have more money. You have money saved up for that event of retirement. You've worked through that whole process of building up your net worth to be able to either fund your retirement or leave to your grandkids. So you have more money, more network. And the other part that's unfortunate is your health is also going now the opposite direction, where you're not getting as healthy. Now you're developing, people have early onset Alzheimer's, early onset dementia. They're starting to cognitively decline just a little bit, and there's nobody to protect them. Kids aren't in the home, grandkids aren't in the home, and there's less and less that they can do to really protect themselves without that network. So it's important that they rely on the network that they have in order to build up and actually keep everything that they've worked their life for, because the scammers are right there to get it. And again, it's network, it's the amount of money that they have, the access to it, and a lot of times they even go after people with low income that might have had a little bit of asset, and it puts them in a dire strait. And along with the heartstring scam, another good one. Unfortunately, it's just I find it interesting in these different scams. Is that service dog that you've always wanted? Oh, you saw that picture online. Looks great. It's trained up. It's ready to go. You're excited for that purchase. You make this purchase of this few $1,000 dog, and then you stand at the airport and it's never coming, because they said, well, you need this companion. This is a great opportunity for you. And this online stuff where there's no actual physical animal to touch. Unfortunately, the seniors, for some reason, tend to have more of an issue with it.
What steps then can older adults take to protect themselves from being scammed?
Be open, and if you notice that somebody has more information than you gave them, there's you're not expecting that telephone call and they keep calling. You have, really just things don't seem right. The hair stands up on the back of your neck. Hang up the phone. Don't engage in that online activity. Just stop right there. Just put the brakes on and stop. Do the research. If it's regarding insurance and you feel like you're being defrauded, or you think that there's something happening with your insurance, contact your agent. If you don't have an agent, call me. I will gladly step in and help you navigate that issue. But yeah, just give me a call. Let me help you. Let me stop the scam, stop it from occurring again and again and again. And the other part is, you really need to keep law enforcement in the loop.
Yes, yes, yes. And, how can viewers find you, your location, and contact you?
Oh, absolutely. So I'm located in downtown Rockville. All calls are recorded. Just click 0 for me, and it goes right to my desk.
Thank you so much for being on the Dr. Powell Show. Again, the information will come up on your screen. Please be careful, be cautious. Any advice, last-minute advice that you can give to viewers?
Absolutely. If you have suspected that you're a victim of a scam, if you feel like you're in the process of being a victim of a scam, let law enforcement know immediately. Call your non-emergency number for your local one. I don't know where you're going to air, but it could be the state police, it could be the Vernon police, but you contact them. Let them know so they can get more information about how these scams are happening and the best way to stop them from happening to somebody else. Very important that you put an end to it, not just push it off and say, oh, well, it happened to me.
Thank you so much for being on the Dr. Powell
Oh,
Show.
no, you're welcome.
This was great information. And again, if you or anyone you know, any elderly who is going through this, please email us at powelltherapysolutions@gmail.com. Do not forget to take the information off the screen, and we'll see you next time. Thank you. Hi, I'm Dr. Keisha Powell, CEO of Powell Therapy Solutions, LLC, and the host of the Dr. Powell Show. I'm a performance psychologist, a certified and licensed autism therapist, and a board-certified sexologist with the American Board of Sexology. Here at Powell Therapy Solutions, we're changing the dynamic of how persons diagnosed with autism spectrum disorders receive services and how treatment is delivered for trauma care. For more information, visit our website at powelltherapysolutions.com or email us at powelltherapysolutions@gmail.com. Remember, Powell Therapy Solutions, real support, real growth, and real inclusion. Hi, I'm Dr. Powell, host of the Dr. Powell Show. Remember, click on the givebutter.com/helpcvc, donate now.